Okay, hello everybody. Thank you all for joining me today for the next webinar of our Total Body Health Renew You series. And my name is Dr. Nick Yap, and today I will be talking to you all about the ins and outs of sciatica, what it is, how it happens, where it can stem from, and what you can do about it. So let's start. What is sciatica? Now, the term sciatica or sciatic nerve irritation refers to leg pain that can travel down the leg. Typically, it can start in the lower back or refer pain into the glute or your butt muscles, travels down the leg or thigh, past the knee, and at times it can go down and refer pain or radiate pain into the heel or the foot, mimicking potentially an Achilles tendinopathy or plantar fasciitis. Typically, when somebody suffers from sciatica, they report symptoms like a constant achy pain, either in the thigh, leg, calf, or foot. It could also be a sharp stabbing pain or an episodic radiating pain, which is dependent on the position of the body and, in particular, the time of day. In the clinic, we hear a lot of our patients that may struggle from sciatica to have pain that is typically worse first thing in the morning, accompanied by a lack of lower back pain. They do report morning stiffness upon waking and sort of, as they sit up in bed and gravity sets in, putting a little bit of pressure on the spine, they can report either an temporary increase in their back pain, thigh pain, leg pain, calf, or foot pain. And the leg pain, if present, is usually worse first thing in the morning. Some other symptoms associated with sciatica do include potentially numbness or tingling, like a pins and needles sensation, or maybe ants running up and down the leg or into the foot. There may also be muscle weakness, in particular, specifically the muscles that are innervated or supplied by the sciatic nerve. In this case, your lumbar spine, specifically in the lower levels of your lower back, lumbar spine L4, L5, and S1 come together as a bundle and make up the thick and taut sciatic nerve. Another complication of sciatica can include drop foot, where somebody may have one leg where when they're walking, they're able to pick their leg up, or this motion, what we call dorsiflexion, or picking up the toe up to the nose. Typically, if somebody suffers from sciatica, they can have mild drop foot. They can also report difficulty with balance, particularly during the single leg balance, either in their walking pattern, in going up and down stairs, or hiking on uneven ground. And the other thing to note is some might even report a miss or discoordination of the leg. I've heard some where they say that the leg feels off, or the leg just doesn't feel the same as the other leg, or it doesn't feel right. A common one we hear is that my leg feels heavier than the other leg. Not saying that that is associated with sciatica, but they tend to report those types of symptoms along with sciatica. The drop foot is particularly important to note, especially if you or you know somebody who may be suffering from drop foot, to get an evaluation. And the reason being is that if somebody has a drop foot, as they walk, they tend to drag the toe, and one of the risks include falling. As they stub their toe more often around the house, on furniture, or when they're walking out on the crosswalks and you have these uneven sidewalks, they can stub their toe or trip on that foot, leading to potentially further complications, maybe an injury to the wrist, elbow, shoulder, or hip as they fall, or progression of their lower back condition, leading to an aggravation or an increase of their sciatica or sciatic nerve symptoms. Now, this is a photo of somebody's lower back, a graphic, of course, and as you can tell, at the level, if you pay attention to the mouse on my cursor here, the sciatic nerve is made up of 3 nerve root segments in your lower back. specifically L4, L5, and S1. And they come together and form a thick bundle of nerves that exit the pelvic cavity into the gluteal area. So if you pay attention to that blue line, you can see that it starts in the lower back. It travels down the glute through or above or underneath the piriformis muscle. It travels down the back of the leg and the hamstrings, which is why some may even report my hamstring is tighter than the other side, even though they haven't been specifically training that left or right leg. They can also report pain behind the knee that mimics knee pain when in fact it is a sciatic episode. They could also report pain in the calf muscle down to the heel or even to the outside of the lower leg and foot, mimicking other symptoms like an ankle sprain potentially or plantar fasciitis. So that is an image of the sciatic nerve distribution and how the sciatica or the sciatic nerve irritation can present as pain in the lower back, in the buttocks, in the groin or the hip, hamstring, calf, heel, and foot. Next, I'd like to talk about several risk factors of somebody developing or sort of associated specifically with sciatica. One of the most common conditions that we see in the clinic that lead to sciatica or, as a result of having sciatica is a lumbar disc herniation. Throughout our spine, we have these intervertebral discs. For the sake of this presentation, let's call that the donut in this case. The disc is very important in our spine in terms of creating shock absorption, but also to help give your spine fluidity of motion as we bend forward, bend backward, and twist as our joints slide and glide. What we found is that sciatica tends to happen from a disc injury in the lower back via a repetitive stress or strain to the tissues of the disc. It's more common for the disc to be injured or strained or have little micro tears in the back or posterior portion of the disc, because when we bend forward, we stretch the posterior or the backward fibers of that discal tissue or the annular fibers of the tissue clinically. And a lot of times that repetitive stress and loading can lead to a herniation, protrusion, or a mild disc tear, which creates an inflammatory response. And as a result of that inflammatory response, you will have swelling in the area of the disc joint or nerve root as it exits that space and cause localized compression to that nerve root, then creating referral pain in, it could be pain, numbness, tingling, pins and needles, tightness, or heaviness down the affected side. There was a earlier study in the 90s that suggested repetitive flexion or bending forward and twisting under a load. So first thing on top of my head are warehouse workers, truck drivers, individuals and professionals who work sort of in a forward bent posture while carrying something in front of them and twisting. So for the example of the warehouse worker, if they're unloading pallets and pallets of 40, 50 pounds or 20, 30 kilos of goods or items and picking them up from the floor and then twisting, that repetitive motion puts somebody at a potential risk for creating micro tears in that disc if done enough times over the course of X can lead to sciatica. That's not to say, however, that repetitive forward bending and twisting will cause a disc tear or injury leading to sciatica, but it just puts you at a higher risk of doing so. Because there are many professionals today who engage regularly in these types of motions, forward bending and twisting, and have little to no back pain. And that is in part due to the stability of their lumbar spine or the lower back and the resiliency of those tissues to be able to withstand and absorb that type of repetitive force. And a lot of times they have a really strong core. So it helps to limit the amount of motion in one particular segment of the lower back and evenly distributes the force or the stress of the motion throughout the entire spine, decreasing the risk of somebody developing a disc injury. Less commonly, sciatica can come from high impact sports. Off the top of my head in particular is American football, ice hockey, any type of hockey really, rugby, lacrosse, X Games, combat sports. And another way to potentially develop sciatica is from a motor vehicle incident. Now, with the seatbelt and the waist belt in place in the car, either it be if it's the more severe the motor vehicle injury, the higher the risk of somebody injuring the tissues in the lower back, leading to sciatica. And lastly, a traumatic event. So say a bad fall, or if you landed improperly, or just any type of trauma that creates a sort of a whiplash effect in the area of the upper back, lower back, or the neck, can lead to a disc herniation. Now, people do get disc herniations in their neck, leading to shoulder, arm, and hand pain, but we'll save that for another webinar. Today, we'll be focusing on sciatica specifically and the areas at which are involved, which is the lower back all the way down to your toes. Some other risk factors we found that may not necessarily lead to sciatica, however, has a somewhat of an association to sciatica, is high psychological stress. A lot of times, individuals who suffer from sciatica tend to report higher than normal or than their usual pain levels during high periods of stress. And I think this is in part because stress is stress to the body. The body has no way to differentiate physical stress from emotional, mental, and psychological stress. Therefore, when somebody is potentially going through a particular stressful time in their lives, it can increase, exacerbate, or bring up the pain from old injuries. Now, on this next slide, you'll see several images sort of showing how exactly the lumbar disc injury can come from. So on the first image on the very far left, you can see this gentleman here lifting what I would assume is a heavy box and twisting to one side, and then having a moment of a sort of sharp stabbing pain or potentially an audible pop, leading to, oh, I throw my back out is one of the most common complaints that we hear in the clinic. And the next image to the right, you'll see two people on the erg machine or the ergometer rowing. And now, for those of you who row, I will note that this is probably not the appropriate or the correct technique to be in during the catch position of the row. But as you can see, this is more so to demonstrate the repetitive, excessive bending forward of the lower back, not able to stabilize the pelvis and lower back, leading to repetitive stress of the disc in the backward portion. As you'll see in the third photo to the right of that, this is a sort of a mock graphic of your lower back or the lumbar spine. And if this is the front of the body and this is the back of the body, and you can see as somebody is bending forward, in the red area, it's repetitive stretching or micro tearing of those fibers of the disc, the annular fibers, which leads to a progressive and localized inflammatory response, thus creating swelling in the area and can potentially put pressure on the nerve. Now, we know today, based on a lot of neurodynamic studies, that nerves do not like to be pushed on and they do not like to be stretched. The final image to the very far right is an axial slice of an MRI or magnetic resonance imaging of the lower lumbar spine. And as you can see circled in the red dot there, there is evidence of a disc protrusion or herniation, which is that little black dot over there in the area of the spinal canal, leading to potential complications or essentially physical pressure or compression of the terminal fibers of your your spinal cord. Now, this is just a graphic of what a protrusion may look like. There are several different studies that reference different terminology, but for the sake of this presentation, we'll use protrusion as a sign of micro tears through the posterior or the back portion of the disc, leading to some of the nucleus pulposus or the jelly inside of the disc to seep into those areas of a tear, but not necessarily coming directly out of the spine. So it's a protrusion, however, the nucleus pulposus or the jelly is still contained within the fibers of the disc. This next photo, the extrusion, is a little bit more severe than a protrusion in that the tear is all the way through the fibers of the disc, leading to a potential outpouring, or in this case, an extrusion of the jelly outside of the donut, which puts immediate direct pressure on either portions of the spinal cord or the nerve root, depending on which direction. In this image here, you can see it's coming out straight through the midline. However, this can happen in different areas of the disc, most commonly being the posterolateral or the back and to one side of the disc, about the area where the nerve roots tend to exit from the lateral canals of your lumbar spine, which is why sciatica tends to be a little bit more one-sided compared to both. Other risk factors for someone developing sciatica include lifestyle factors, obesity being one of the more common ones. And not to say that somebody who is obese will have sciatica, but rather it's the association between the muscular physiology of somebody who is obese or lived a potentially deconditioned or sedentary lifestyle can lead them to a higher risk of developing sciatica. And one of the hypotheses lately, based on current best evidence, is that individuals who are obese tend to have fatty infiltration of their deep stabilizing muscles in their lower back, specifically the multifidi and the rotatories group. Based on several MRI studies, they have seen some modic changes, meaning changes in the signal intensity of the MRI that show that parts of those deep stabilizing little muscles have fatty infiltration, meaning they have been deconditioned and therefore fatty cells are now infiltrating those portions of the muscle, leading to less stability or more motion in that specific segment of the lower back. And so if they potentially are obese and also have a job that requires them to do a lot of repetitive forward bending and lifting, you can expect that there will be more motion than normal in those segments, leading to progressive or increased stretching, thus micro tearing of those fibers in the disc, then leading to potentially a disc injury resulting in sciatica. Smoking is another risk factor, and this is because smoking introduces a lot of free radicals or reactive oxygen species that oxidize, parts of the cells in your body, which creates an inflammatory response, thus leading to an increase of a systemic inflammatory response in the entire body. So not to say that smoking causes sciatica, but if somebody had a predisposed risk to a disc injury and sciatica, smoking will only exacerbate or increase their symptoms because of the inflammatory process. And finally, living a sedentary lifestyle. If you're spending 8 to 10 hours a day, working from home or at your desk without a lot of movement breaks, you are at a higher risk for potentially developing sciatica. Again, not that living a sedentary lifestyle would lead you to develop a disc injury or sciatica, but rather more of a risk factor for so. There are other risk factors that are less commonly associated, but can result in somebody suffering from sciatica. The pregnant population would be the first ones. If you can imagine a pregnant individual in their third trimester, where the baby's position and orientation in the womb may potentially put pressure on the nerves or part of the nerves in the pelvic cavity or sciatic nerve, leading to sharp stabbing or shooting pain, or the symptoms that they described earlier, down one side of the leg or both sides of the leg or in the hip. Low back pain tends to be pretty common in the pregnant population as well, purely due to the vast growth of the baby in front of the body, leading to excessive lordosis of the lower back, which then can create irritation of the facet joints. Lateral canal stenosis, which is the space on the sides of your spine where the nerve roots from the spinal cord exit out, can also create sciatica. And it does so by degenerative and arthritic changes in that canal, leading to a bone growth or bone or spur formation in that canal, which can encroach or close down or narrow that space, which then puts pressure on the nerve root, leading to sciatica. Some other less common but probable risk factors for somebody developing sciatica would be a space-occupying lesion, or a mass or growth of some sort, either benign or cancerous, that is occupying a space in the spinal canal or in the space of the lateral canal in the spine, leading to physical pressure or compression of the sciatic nerve. I briefly talked about piriformis syndrome earlier. Piriformis is one of the muscles in the hip, specifically the sciatic nerve can travel. Typically we see three variations of piriformis syndrome presentation. One being the most common is that when that muscle gets super tight and tonic, or if there is some mild strain or tearing into that muscle, which creates an inflammatory response, you can have swelling in the area, which puts pressure on the sciatic nerve, since the sciatic nerve travels either above it, under it, or at times it can even pierce through the muscle. It's quite rare in those cases, but highly probable for those types of anatomical variants, for when that muscle gets super tight and tonic, it can create localized pressure of the sciatic nerve, leading to sciatica. And lastly, another potential cause for sciatica can come from lumbar spondylolisthesis. Now, this is less common and more of a traumatic origin. Typically, we see spondylolisthesis, which is another fancy term for when you get into some sort of traumatic, abrupt trauma. The spine will either, a portion or a segment of your spine will either shift forward or backward, which can then close down on the lateral canal where the nerve root exits and put physical pressure or irritation or even potential mild tearing of a portion of the sciatic nerve, which can lead to sciatica, although it's typically mostly associated with a traumatic type sort of cause. However, somebody who has had a lumbar spondylolisthesis from the past, 20, 30 years later, they could potentially engage in some particular activities that can irritate that old injury, thus leading to sciatica. So, next slide, we're going to talk about how exactly does the disc cause leg pain. It's been currently theorized and studied that local irritation and inflammation of the nerve root, either at the levels of L4, L5, or S1, can create an inflammatory response to the area, leading to radiating pain, weakness, and potentially other neurological symptoms in all of the areas that are supplied by the sciatic nerve. So essentially from your lower back into the buttock and all the way down the entire leg. Because down the leg past the knee, a bunch of the nerves, like the tibial nerve and the fibular nerve and all of its communicating branches, stem from the sciatic nerve itself. So if you have an irritation to the actual bundle up higher in the nerve root, it would affect the entire course or most of the distributions of the communicating branches of that nerve. If you look at the image to the very far left, this is a example graphic of a damaged lumbar disc where the nucleus pulposus, or the jelly in this case, has herniated out of the disc because of a tearing, either due from traumatic or repetitive stress and loading, which then puts pressure on the nerve, creating an irritation or an inflamed nerve, leading to sciatica. The greater the compression, the greater the neurological symptom. Meaning, if there is more pressure or more stress to an area of the nerve, you are essentially cutting off not just the function of the nerve, but blood supply to the nerve, which, if not corrected quickly, could potentially lead to permanent deficits in your neurological symptoms. And we'll talk about that more on the next slide. So it's currently understood that local irritation and inflammation from the disc and the joint can compress the nerve root, leading to sciatica or radiating pain down the leg. In severe cases where there is a lot of compression on a portion of the sciatic nerve or nerve root or nerve roots, depending on the location of the herniation or injury or cause, it can lead to a phenomenon called Cauda equina syndrome. And if somebody presents with symptoms or is suspected to present with symptoms of Cauda equina syndrome as screened by medical practitioners or ourselves in the clinic, we usually warrant a same-day emergency referral for a neurosurgical consult. And this is specifically for patients who, or individuals who report symptoms of urinary retention or incontinence, saddle paresthesia, where when somebody has a bowel movement and they go to wipe and they notice, when I'm cleaning myself or wiping that area in the anus, I don't really feel that area, or it feels numb. That is not normal and can be coming from a compression of the nerve that supply sensation and muscle activation to the muscles of your pelvic cavity or your pelvic bowl. If somebody reports some type of sexual dysfunction that is recent, either from an injury or as a result of sciatica, it can also warrant a same-day referral. And in most cases, for these types of same-day urgent referral, the main goal is to prevent progression of the neurological deficit, which any one of these symptoms that I've described. And in severe cases, they may be going into surgery to help create surgical decompression of that nerve, to allow that nerve to restore its blood supply, essentially to take pressure off of that nerve to let it, for lack of a better term, breathe a little bit, to gasp for air, to allow healing to start. And the reason why it's urgent or emergent for us as practitioners is to make sure that we catch it early and respond quickly, because if we don't, there is a higher risk for these symptoms to become permanent, because it can lead to permanent damage of the sciatic nerve itself or the branches of the sciatic nerve. So, all things sciatica. Here are some things to keep in mind. I really love this quote that I learned from Dr. Michael Maxwell, and he says, one really important thing to understand about sciatica is that sciatica is not a diagnosis. Sciatica is a symptom, specifically a symptom of the possible causes, one most commonly being a disc injury. However, in order to determine why somebody is having a sciatica or sciatic episode, a comprehensive assessment is required by your healthcare practitioner in order to determine the correct diagnosis, then leading to an appropriate treatment or referral. With sciatica, we found that the rate of recurrence is quite high. Like I would say 80 to 90% of the people who have sciatica tend to wait it out and it'll go away on its own, but then come back 6 months later or 1 to 2 years later, or have this chronic issue ongoing for many, many, many years. And I believe that that is because, one, we know that sciatica's rate of recurrence is high, But if they haven't received a proper evaluation to determine actually why and what is causing their sciatica, then it's just going to keep coming back. That's where we step in as practitioners, is to help you and our patients determine exactly what is causing your sciatica. And once we understand what and where it's coming from, we can then create the appropriate treatment plan or appropriate referral to other practitioners involved. I'll briefly remind us that sciatica can take many, many forms and symptoms, and they all differ between individuals, meaning my sciatica is not the same as your sciatica because we're all built differently and we all have different lifestyles. So some may have back pain, no leg pain. Some may have leg pain, no back pain. Some may even have weakness, numbness, tingling, pins and needles, or constant radiating pain. It all depends on the severity, the quality, and the orientation and the cause of the injury leading to sciatica. And just some closing notes here. Sciatica is considered a neurological disorder because it's part of the nervous system of your body and your spine, and that your nerves, specifically your nervous system or sciatica, can be influenced by your mood, your stress levels, and more in particular, your sleep. Good sleep is very restorative for all conditions. And if somebody is struggling with sciatica, they tend to not sleep too well, which, as you can see, how that can turn into sort of a vicious cycle. Because if somebody isn't sleeping well, their body isn't resting or recovering well. And if their body isn't resting or recovering well, their mood is going to be poor the very next day because they didn't sleep enough. And then when their mood is bad for a certain amount of time, then their stress levels will increase. So you can see this sort of vicious cycle into just the interconnectivity between those three aspects and how it can influence your sciatica. So if you or you know somebody who may be suffering from sciatica, what can you do? Well, for starters, reach out to a trained professional, either be a chiropractor, a physio, an acupuncturist, your medical doctor, your orthopedic surgeon, or your nurse practitioner to determine exactly what is causing your sciatica, where it's coming from, and immediately work on strategies to help find you some relief positions and tailor a specific treatment plan to your needs to help you over the course of the next 3 to 6 months, depending on the severity of the injury. It could be a little bit longer if you've had this issue for a very long time, or if it's a little bit more severe, but typically what you can do in these times is to help by keeping track. One of the things you can do is to pay attention to your pain patterns, because this information will also be quite helpful in you understanding what are some positions of relief, what times of days that you tend to feel worse pain, and how you can maximize the rest of your day, because that will make your recovery process and journey much more satisfying than it being just, uncomfortable and in pain all the time. Time of day, you can track. Your pain scores, you can also track. And you can also track what specific positions where you feel the pain the most and what positions you feel the pain the least. And lastly, the thing that you can do while you're still waiting for an evaluation is to remain active. And this varies from all people of all physical fitness levels and ages and sizes. But what's important is that you stay active and you can engage in active activities like daily walking. When, there is no real range as to how much or how far you should walk, especially if you're suffering from sciatica. There tends to be a sweet spot. Maybe it's a little bit stiff as you start to walk, but then it starts to ease up 5-10 minutes. And then maybe your threshold is 15 minutes. You get to 15 minutes of walking, you're like, okay, now it's aggravated again. At least you know that your threshold is 15 minutes. Therefore, you can at least start there and work on 10 minutes at a time, 10 minutes at a time, and then maybe increase that as the weeks go by or as the sensitivity of your sciatica decreases. You can also try swimming. When we're in the pool, we tend to be much lighter than we are. So gravity isn't necessarily a contributing factor here to help relieve some pressure in your lower back. thus leading to less compression of the nerve and less sciatica. The other thing you can do during sort of really bad episodes where the pain is just unrelenting is you could try to find a position of relief. Very commonly, we find that our patients respond to laying on their back with their legs bent and up, supported either on the edge of a chair or a wall, and just to focus on gentle abdominal breathing, feeling the air expand into the lower back and rib cages, and then allowing that space to relax as they settle and help to relieve some of their pain. Now, how can chiropractic help with sciatica? Sciatica is highly treatable and very commonly managed by chiropractors as experts in neuromusculoskeletal system and of the spine. At Total Body Health, we tend to apply a number of therapies, not just spinal adjusting or chiropractic adjustments, to help with disc injuries or sciatica. One of them being neuromobilizations by Dr. Michael Shacklock, who founded Clinical Neurodynamics. He has essentially contributed a big piece of how the nerves act, behave, what are their thresholds for sliding and gliding, and how much pressure can they tolerate. And so with neuromobilizations, we can help slide and glide and relieve pressure on the nerve roots during the acute episodes to help our patients find a position of relief. We also apply Robin McKenzie's mechanical diagnosis and therapy, or what we call a directional preference, to find a specific direction in your body or in your motion where, for example, if forward bending is painful and backward bending is relieving, we would essentially prescribe that direction for you as homework on top of other rehab strategies. I mentioned spinal manipulation or chiropractic adjustments to help relieve pressure and restore mechanics of the joint and, disrupting sort of the pain signals in the body temporarily to help reduce pain, inflammation. We also do some soft tissue therapies like ART, pin and stretch, some instrument-assisted tool work or scraping or Graston to help the affected areas to essentially relax so that you're putting less pressure along the entire distribution of the sciatic nerve. And finally, the best and most favorite strategy for us here at Total Body Health, since we all take a very active approach to care, is strategic rehabilitative exercises to help improve the deep stabilizing muscles in your lower back so that you can do things around the house, engage in activities of your daily living that minimizes your pain or prevents from further aggravating the pain. Along with all those therapies that we offer here at Total Body Health, we also help determine the root cause of your sciatica, specifically to rule out Cauda equina syndrome, as we screen that in all of our patients that come through. We also help determine the need for imaging studies. If an imaging is required, we tend to start with an X-ray followed by an MRI as a diagnosis for a lumbar disc herniation, since an X-ray itself is not enough to definitively diagnose a disc herniation. However, there are some markers in X-rays that, when we pair with our clinical presentation, can help us make a very strong case if somebody we suspect is having a disc herniation. And then finally, after all of that, as part of our comprehensive history and examination, we then help determine a treatment plan and speak to you about our prognosis of care moving forward. That is it for my presentation today on sciatica. I'd like to thank you all again for joining me today and spending your dinner time listening to me speak about sciatica so that you can potentially help share this resource either for yourself or somebody who you think may be suffering from sciatica. Special big thanks to Dr. Michael Maxwell, owner and chiropractor of Total Body Health, for arranging and organizing the Renew You series from our Total Body Health. And Drake, my colleague and fellow registered kinesiologist at Total Body Health, for helping me put this presentation together. If you have any further questions about this presentation, or if you would like a copy of this presentation or any specific questions, please send them to my email address here below. It is drnickyap@gmail.com. I'd be happy to respond to your questions, and we can have a discussion then about what steps need or you should be taking moving forward if you or you know somebody who may be suffering from sciatica and they have questions. Thanks again, everybody. Thank you for joining me today, and I hope you have a wonderful day, and we will see you in our next Renew You webinar series. Take care.